Caidya is very strong in the United States, in APAC.
They really augment our European position: oncology, rare disorders, cardioinflammatory, cardiometabolic.
We start early phase studies, move to phase 2 and phase 3.
Client and patient focused culture.
We're going to sit down today and talk about some exciting news. Caidya and Simbec-Orion have come together. When you started discussing this, what convinced you that these two companies would be a good fit together?
Yeah, it's really interesting thinking back at the earliest days when we started our conversations. It was really clear when we evaluated the company that there was so much complementarity from a geographic perspective. They really augment our European position and really strengthen it. Also, they have additional skills and capabilities that Caidya does not have independently. For example, the ability now to take healthy volunteers into our studies and to start the study earlier on, from early phase all the way through registrational trials. That was really important to us. Also, they have the ability to provide laboratory services. So they have a very, very well-established, highly regarded MHRA accredited laboratory in Wales that has a full suite of capabilities and also the ability to do investigational drug manufacturing on site. And so we'll be able to provide those services to existing Caidya clients and new clients, and be able to also take all of our studies from healthy volunteers all the way through. So geographically, capability-wise, very, very important. Importantly for them, they also were looking for an opportunity to build out their geographic expertise. And so coming together, we really met the strategic objectives that were in place for both companies. But beyond that, when we met them and started understanding how they go to market, how they sell, it was really clear that the emphasis on oncology, rare disorders, and other complicated therapeutic areas was a critical part of their strategy. And having that expertise to satisfy the needs of sponsors and innovators in that space really complemented how Caidya thinks about our market with those therapeutic areas, but also, of course, in cardioinflammatory, cardiometabolic, and a little bit in CNS. So we felt that the combination of focus in terms of therapeutic areas, expertise, was really, really also a key part of how we serve. And then the final thing was the sort of partnership mentality that we saw from them, how they really lock into their clients, and the sort of agility and ownership that they bring to clients, I think, was also something that we felt was really complementary. And, of course, we spent time walking in the sites and getting to know members of their team. It just felt like so much the same kind of client and patient-focused culture that Caidya really brings forward on all elements. It just felt like a really natural coming together. So we're super excited about it and just can't wait to keep working with them and building out the strategy for the combined business.
Well, I've been operating in Simbec-Orion for 30 years because I'm the co-founder, so I know this business very well. And I know also that some of our weaknesses was global coverage, because we are very strong in Europe. We worked in the United States a little bit, but in APAC almost not at all. And as we are working more and more with clients where we build long-term partnership, we start working with them in early phase studies, and then we move to phase 2 and phase 3. And of course, to successfully deliver phase 3, you need to cover more territories. So the combination of Caidya and Simbec-Orion makes sense for geographical point of view, because Caidya is very strong in the United States and very strong in APAC, in particular in China. And this is an obvious, fit and very complementary services.